from Merton Centre for Independent Living on behalf of the Community Engagement Network.
I'm Councillor Kelly Brand and I am a council member for Children's Services.
I'm Doug King, I'm a local GP, Sharon Corner, and CCG Clinical Director for East Merton Health and Wellbeing.
I'm Jack Martin, I'm Director of Public Health in the Council.
Will introduce himself when he sits down. I should also say that Andrew has replaced Karen Worthington on the board, so welcome to your first board.
Kevin O'Malley, Chief Executive, Merton Voluntary Service Council.
Thank you very much. Any declarations of pecuniary interest? Thank you. Minutes of the previous meeting are in the pack. Are they agreed? We're going to take item 5 first so that Darren can get home. So I'll pass over to Darren.
Thank you, Chair. If it's okay with yourself and the rest of the board, I'd just stand and present this and give it my all from there. Thank you. Thank you, Chair. Thank you, Board, for having me here. So, as I said there, my name's Darren Tully, and I'm the Borough Commander for the Fire Brigade for Merton. I am not here in that capacity, so please don't see me as the Borough Commander for this particular role. Jed Curran, the Chief Executive, asked me if I would chair the community plan for the Borough for 2019 to 2025, which I somehow managed to get drawn into. But it's a fabulous opportunity. It's a good opportunity for me to deal with a lot of voluntary sectors and a lot of partners in there. So I've got a number of asks of the board and some questions for you and some really to try and poke some of your interest and see if I can get some sort of some ideas and some responses from you. So really, just a little bit before we start, a bit of background to what the community plan is. So, first slide. So the community plan is a recurring plan. It was originally thought out of the Local Government Act in 2000. The requirement for local authorities to carry on with that has since ended. However, a number of councils have decided to continue, and Merton is one of those. It's going to be replacing, so we're looking at replacing the previous plan, which runs out this year and will run for another 5 years beyond that. It's going to be developed by the Merton Partnership Board. So the idea is really to set out the Merton Partnership's long-term ambition for the borough. We're going to be looking at increasing social capital. Now, social capital is one of the big words that we'll be using, and social capital really is defined as, there are many definitions, but really it's defining the links between different groups, organisations and people, and then how we can measure that and how we can encourage different organisations to link up. And there's various different benefits for increasing social capital, including health, law, prevention and community cohesion. We're going to try and embed the family theme across Merton as well, and across the partnership, trying to linking everything we do is trying to link and make the family as the whole unit rather than the individual. And we're going to make the plan easily accessible to everybody. So that's the residents, the councillors and all the partnerships. There's going to be a number of different formats, but at the moment we are in very much the planning stage. So the ideas at the beginning are going to be a paper format, and we're going to be looking at distributing that to residents, but also an online format in which it will be kept up to date, and we can adapt the plan as we continue over the 5 years of the plan. So our approach initially to undertake engagements with residents, voluntary sector groups, community organisations and the Merton Partnership. We're going to be using 28 different indicators to try and build up a picture of social capital in the borough. Now those indicators may be things about like voter patterns, about who votes and who doesn't vote, volunteering rates, where people live, access to parks, access to voluntary sectors, and the social infrastructure. So we want to try and build up a picture of how the borough looks. And we know there's a massive divide between the east and the west of the borough, and perhaps there's some correlation between social capital between the east and the west of the borough, and about how we can, once we've highlighted those, what we can do with that and how we can try and increase the social capital to try and improve the community cohesion and infrastructure in the borough. As I said, it will have an online presence, so it'll be something that people can dip into, and we're quite keen on it's going to be a usable thing. And when I was asked to do this, I was very keen that I wasn't going to write a report that was going to sit on a shelf in somebody's office and remain like that forevermore. I wanted this to be an interactive plan and something that everybody could use, even if it was a reference guide. So a matter of, for example, you may have a young mother who's got a couple of children and she doesn't know anybody in her street. How can she utilise the social groups around her, the voluntary sectors, the health sector, neighbourhoods, people in her road, to increase her health and well-being in her particular road and in the borough. So it's about an online resource. She can go online and find out where the toddler groups are, where somebody of sort of similar interest to her may be, etc., etc. But that will go across all different groups in the borough, and all different societies and different groups. So I want it to be able to be something that we can actually pick up. And I know from my own personal experiences, different things like WhatsApp groups or the Friends of, or the Merton Mums, they're all different, one of those many different tools that people can utilise. And I want to create that tool to be able to link those people up. But also some of the bigger projects that may help with some of those communities and some of those people in probably the more needy parts of the borough. So the plan will as well look at, I want it to be measurable as well, and we often talk about the word measurable. We want to actually show that what the previous plan has done. So we want a lot of, actually you asked for this in the past, and we want to be able to show what the previous plan has done in order to try and energise that momentum within the plan to try and keep it working. So for the engagement, some of the things that we've done and we are looking to do, so far the Children and Young People survey, we managed to get in on that survey end of last year, luckily by the skin of our teeth. The annual residence survey will have a return on it, so we can start asking questions about what we think is pertinent to social capital in the borough, so we can try and work out what some of the target audiences look like. Target engagement with some of the hard to reach groups, and this is probably one of my asks of the board actually. Some of those groups that we have in the borough, and we know the borough is, as I said, split between the east and the west, but there's also certain groups, whether you can look at the Sri Lankan community or the Korean community, and about that social engagement and how we get to engage with some of those groups, and actually some of the other groups that we don't know about, and some of those groups that you may well know about, and how you've used your links, your skills and your engagement with the community to actually help us get to those harder to reach groups. We want to run some workshops with the voluntary sector and some of the community groups and ask those questions and see what they want and see what the community wants. And we're going to engage with the Merton Partnership via thematic networks and the way days and conferences as well. So we're just trying to grab that data at the moment to see what it is that we want, what the partnerships want, what the voluntary sector wants, and also what the residents of the borough wants as well. So what am I asking tonight actually of the board? So really we would like, please, examples of any projects that promote or build social capital, however small or large they may be. Outline how the board engages with subsidiary groups and organisations that feed into it, and any engagement channels that could be used to support the development of the community plan. Consider whether there are any places or communities that you would wish to prioritise the engagement work in the hard to reach groups, and suggest any channels or mechanisms and how we may engage with them. And really note so far the progress that we've started this development path for the community's plan for the borough, and the next it can be built review of the health and wellbeing strategy. So that is what we would like, and I really, it's my chance now I suppose to put to the board chair about any of those possible suggestions about what the board may have for us. Thank you.
Thank you very much. Questions or comments?
So I think it's great there, and I'm really pleased you're doing this, and I think it would be really great to see the report and the final two obvious points of synergy. One is in terms of the work around building social capital, thinking about some of the work we're doing as a CCG with the council around the Wilson and the East Merton Model of Health and Wellbeing,
Yeah.
make sure that's connected up. But quite a specific point on the directory of service that you, I think that's what you were describing, stuff, a kind of place where you bring a lot of the stuff together that people can access. We're doing something similar for the Treating Young People's Mental Health project that's on the agenda later. And I don't know whether this is also the same thing that is being thought about in terms of Merton Health and Care together. But I guess we need to do some joint thinking about how we bring all the different versions of directories of services together into one place, even if there's something different, if they're different directories sitting behind a single front end. If we can just do that work together to make sure it's joined up, that would be really useful.
Yeah, I mean, just to follow on from Andrew's point, I think we absolutely support this. I think when I come to talk about the NHS long-term plan later, actually you can see that from a health and care perspective, it's not just a local focus on building social capital, but there's increasingly an understanding that some of the challenges that we face as a health and care system require a slightly different relationship between individuals and the state. I think that this is part of that. I think the point around the directory of services is a very practical area where we could work together. We've come to this because as we expand social prescribing, which is in a sense the health lens on community navigation and social capital, we've realised that we need to link up with our partners, particularly in public health, to make sure that we understand what's out there and how to make the best link between people. And I suppose that this is kind of the other lens through which to look at it, but we're dealing with the same sort of civil society and local communities, aren't we? So I think if we do have an opportunity to do that, for me actually there's a continuum of different types of services that come from slightly different contexts, but actually in terms of what they do, they're all broadly similar, we just call them slightly different things.
Yes, thanks, Darren. I really welcome the focus on social capital, and also just to say really, not just that it will bring together the views and the enthusiasm of the voluntary sector, but I think more particulars about residents. It's about that social capital that is there with residents. We've given some examples as to what you intend to look in terms of the people connecting in the community and to be able to do that seamlessly. But I think it's also important when we're doing this, when we're engaging with the communities, to make them make it community-centered, make it people-centric. So it's about them driving this plan and the solutions that we're looking for.
Yeah, so Darren, many things. I'm echoing what the others have said. There is obviously an observation that on our agenda tonight there are 3 plans, and one can start to feel slightly fatigued, possibly about the glut of plans. For me, what is really, really important is that they speak to each other and complement each other. And that's why I particularly welcome that the community plan doesn't pretend or aim to be the Uber plan, but be really complementary and supportive of all the other stuff that we want to do. And I think the choice of social capital is really welcome because it's a positive approach. It's not focusing on what's broken, it is focusing on what we've got, and Merton has a lot to offer. So absolutely, and very, very welcome the very close working together with the Health and Wellbeing Board strategy. We will hear a bit later about it, and James will talk about the local health and care plan. I think we are all pulling in the same direction.
Yeah, I mean, really interesting. We remember being involved in the development of the last one a few years ago now, so it's great to see. I think just building on that theme of synergy, and I particularly heard you say a few times about community cohesion, which I thought was really interesting, and I suppose it was just signposting to some of those other policies and strategies that feed into that might be really useful for this. So it would be like the hate crime strategy, it would be the equality and community cohesion strategy. So it's just about tying everything all in sort of the same direction. And And then you were sort of just asking for some examples of, you know, around engagement. And I think one thing that we've been raising for a number of years is that it would be really helpful to have a booster sample on the residence survey for disabled people, because they're, when you look at the responses from the last few residence surveys around wellbeing indicators in particular, they're much, much lower than non-disabled people. So we've, for a while now, suggested that it might be helpful to deep dive into that a little bit. You could do that with a booster sample, other ways to achieve the same outcome as well, but just something to consider. And I suppose the very last point would just be, I can't quite remember when it was, it feels like just 5 minutes ago, it's probably about 18 months ago, there was a Merton Partnership Conference, and that was really focused on sort of strengths-based approaches and ABCD approaches, to easy abbreviations, but I think there were a lot of really interesting themes that came up in that, lots of sort of great thoughts and contributions from you know, voluntary sector and wider you know, public sector partners as well. So I just thought it might be worth revisiting some of those themes to sort of influence this, because there was lots of really, really good thinking done there, which hasn't particularly moved forward. Not had the opportunity.
Thank you.
Yeah, mine was just to echo what everyone had said, but also to be mindful that for me, it feels like there is a lot of engagement consultation that's being bandied around over the last few months, from health and care plans to improving healthcare together, to the NHS long-term plan, to the mental health and wellbeing that we talk about, engaging residents with 5 London, on top of the piece of work here as well. Maybe there needs to be something we can put it together and make sure that we're tying 2 or 3 things together, whereby it's going to extract the same of the information, and just to be mindful of that.
Four things not connected with each other. So the first thing is about the directory, and just wanted to draw people's attention to the existence of the Family Information Service, which already exists, and it should be your go-to place for social prescribing if you're thinking of anything that relates to families. The local offer, which draws together everything for children with special educational needs, and there's an additional local offer now for care leavers. So we're statutorily required to have those, and we want to see those reflected in any directory that comes with the patch. The second is to absolutely endorse the Think Family approach, and say how important it is that when you see an adult in whatever capacity, you understand their parenting responsibilities towards the children of their family, however that family is constructed and defined. And likewise, when you see a child, you understand the adults that are important in their life, and that holds true across our range of services. So 100% committed to seeing that reflected in this plan. The third is just to reflect for the other members of the board how spectacular that return is for the young people's survey. 1,700 responses is phenomenal across our child population. It's really important to us to have young people's voice heard, their residents too, and so I'm delighted by that. And to pick up the point of the previous speaker, that's being used to feed into the Children and Young People's Plan and Health Wellbeing Strategy and elsewhere as well. So really mining that for all of the different plans and strategies. And finally, just an example, I think, around social capital. We haven't talked very much about private business and employers yet. We've talked about what the voluntary sector can do, what the public sector can do. One of the lovely gems that we've been talking about this week is the work we've done with some private employers about employment opportunities for young adults who have found it difficult to find work. Maybe they've got a bit of a difficult history as individuals, maybe not every employer looks at them and immediately snaps them up as a likely kind of person, but we've had some really excellent results with a piece of work through a team called My Futures, and I just want to kind of big that up as a great example of social capital.
Just a quick point. Absolutely support the objectives. Dan and I have met and we talked about this previously. Just to draw attention in particular to paragraph 3.7, the community infrastructure levy, which is funding that we receive from developers, and a proportion of that is put aside for neighbourhood projects. And what we're looking for in a separate board, the Sustainable Communities and Transport Partnership, is how we can use existing groups, enhance existing groups, invite them to seek funding if they require it, to reach out and contact those who are isolated, those who aren't normally part of that organisation. So this isn't about creating new groups necessarily, it's about using the existing infrastructure that we have in Merton and looking at how we can enhance that. So that funding is available. It's just about to be relaunched for the 1920 financial year, and it will be an ongoing. So even though the communities plan may not be agreed until the end of this year, that funding will be a regular allocation. 15% of the SIL will be allocated to neighbourhood projects in the health and wellbeing body. Probably got more to gain out of this whole social capital area, I think, than any of the other boards, given that it contributes directly to health and wellbeing. I'd encourage the board to think about where existing groups could be enhanced in order to improve their reach and look at how we can tap into that.
Just a quick point to expand on. What Dave has been saying. That we, as part of the East Merton model, are trying to have a lot of ongoing engagement work, particularly considering groups which we need to hear from more. So that might be something to perhaps with.
I mean, the things that I've written down before were social prescribing and rules, and so I think there's a lot of overlap there. On the adult side, there is a piece of work going on mapping the lunch culture at the moment, isn't there, for this year, that exists across the borough. And I also wondered about the Dementia Action Alliance, because that brings in a lot of businesses, and there are lots of things that they advertise. I think generally, I mean, this is a topic that we probably skirt around a lot in terms of social isolation and loneliness and connecting people into their communities. So I think you've probably tapped into a very interesting subject area for it. Did you want to say anything in response to any of it, or don't feel you have to? You don't want
No, I think just very quickly, really. So thank you everybody for some of the comments you've made, and I think we were writing to the board as a whole to reinforce what we've had. But really, I think a couple of the points were made that there's a number of plans and a number of surveys, and it's about, and as Dagmar rightly said, this isn't supposed to be the Uber survey, and there is going to be no one, but I think it's important that I'm not going to try and reinvent that wheel, and we're not going to try and reinvent that wheel, but we do make absolute links into all of the other plans where they are applicable to it, so that actually it can remain current and relevant to those people in there. So it's a big piece, and it can, I think, very quickly get out of hand. So that's going to be my part on that.
And just when is it all going to be finalised?
The end of this year is we're supposed to be publishing. I'm just trying to think where the thing was. Yeah, sign off finally autumn this year. So I better get moving. Thank you, Chair.
Thank you very much for coming. Very interesting discussion. Okay, we're now going to go back to item 4, which is mental health and Morden.
So the board will remember that it felt emotional and mental well-being is such an important topic, we're all convinced about it, and the board requested a paper, a report, with some proposals to specifically think through loads of activities already happening. What else could the board do to even more foster improvement? And in order to answer that question, we've got quite a big paper in front of you, which has 2 bits to it really. The first 2 bits I will talk particularly to you are our 2 main proposals where we think the board can add even more, and I want you to really discuss and consider. And then the second part of the paper gives you an overview of what else is going on. It's a bit of a reminder as well what we as a board have already under our belt, and the importance there is that we wanted to use this report to raise awareness again, because sometimes we forget, and also that you all in your constituencies really champion what's already happening, And for that purpose, we've also given contact details, just an email address. So please feel free and actually make use, because it is a rather big paper. I won't go through every single bit, but if then at home you get an idea and you want to engage more, you're very welcome. So that's just the outline, and then letting you know that one of the big interventions, projects, programs that is running at the moment is the Trailblazer for Children and Young People's Emotional and Mental Wellbeing, which I won't cover but hand over to Andrew in a minute. So if I get your attention now to the two things that we feel, after having looked all around, the Health and Wellbeing Board could particularly help, is the first one is to engage and work with Thrive London. Thrive London is a citywide movement you might have heard that is particular strength in community engagement, campaigning and awareness raising. And it has already worked with 17 out of the 33 London boroughs, and you've got in your papers quite interesting, I think, findings from their work. And Thrive London, in a way, offer to bring their resource and expertise to boroughs. And so our suggestion is they have not been yet in Merton, and let's welcome them and use their resource and expertise to engage with our community and use it in a twofold process. So as a campaign and awareness raising exercise against stigma, as well as listening to our community about their particular concerns, anxieties. And I have absolutely listened to Dave's comment to say, oh my God, you know, yet another community conversation, are you overdoing it? I think that is legitimate. Nevertheless, when we listen to residents, we hear a lot of concerns around emotional and mental well-being, and I think there's lots of untapped potential to really tune in what matters to local people. So my first proposal would be in that we will link up with Thrive London, make the contact, and prepare the format they normally sort of helping with is in one type of event. But we will let you obviously know in more details, but I wanted at the moment the first go ahead that the board would support us in getting in touch. The second piece is that mental health and well-being in the workplace has been such a recurring theme, I think, through all our strategies and also in the plan, that we feel again that in Merton it would be a great opportunity to really scale that up. And a lot has already happened in a number of workplaces. There will be schemes, but we feel we want a sort of industrial scale. Because it was interesting again, and some of the feedback we today had in our local public health team meeting, our social prescriber, Ray, and he reported back some interesting facts that a number of his clients say they feel their mental health and well-being is being tainted by poor work conditions, which I thought is something we have to listen to. And I think, Andrew, we have talked as well in terms of the importance of mental health and well-being. You will remember our discussion around the suicide strategy very much highlighted the very high stress levels that our health and care workforce is under, and the substantial mental and emotional well-being issues. And then obviously a big theme is the emotional and mental well-being of our children and young people, and that affects obviously the parents, the teachers, etc. So we have looked around to see how could one go about it, and the idea is in any organizations you will want to look after the staff themselves, as well as enabling staff to be more fluent in responding to mental health needs in their clients. Yeah, so it's a double in gain in a way. And the idea that now gains traction, how other organizations have done it, is a hierarchical model that all staff members, be it the porter, the typist, the assistant, up to the chief executive, have basic understanding of mental health, and then depending on need and specific in work, you have in differential training in intensity. And so you will see that what you have to think of is how you train staff up, and then what interventions are you going to offer. And at the universal level, we have already shared with you before that there's a pan-London offer around good thinking. That is the broadest of self-help tools. It is free to all Londoners. But it is interesting how few people actually know about it. So there's one relatively mundane thing to really make sure everybody knows about it. And then in the specific suicide mental health training, and an aspiration that we have mental health first aiders, those who are more intensely trained to look after staff, to train trainers, as well as those who have particularly vulnerable clients. So there's more in Appendix 3 around models, but the ask in a way for you is that we as a health and wellbeing board commit that we want to give mental health in the workforce a real push, and that you could nominate a lead from your organisation to work with us to help in a way generalise, universalise approaches so that we can share in resources as well as sensibly as possible. So those two, if you can hold those, are the asks and proposals where the Health and Wellbeing Board could do more. In terms of the next section of your paper, it does give the overview. As I said, the trailblazer I leave for Andrew. I wanted to mention the primary mental health care services, and Andrew and Audrey, you might want to chip in. I think it is really important that the board is aware of this new service commissioned by the CCG, because a lot of our staff is also resident in Merton, and therefore, depending on their emotional and mental health need, can have absolutely access to this service. And it is a really new model that absolutely embraces the well-being element as well as the more specialised IAP psychological therapies. So there is contact numbers and for you to really champion that. And Andrew, if you want to chip in a unit, you might. I wanted then to just draw your attention, we've discussed the suicide prevention framework before. The training is very pivotal to implementing what we've committed to. I will remind you as well on the autism strategy that this board has approved, and there is an action plan that needs to be enacted. And again, the training, the awareness raising component is a very essential bit. And then quite a while ago, this board asked or approved the substance misuse strategy. And again, when we think about mental health and well-being, alcohol and substance misuse is very, very closely related. And again, it is quite amazing in how much awareness in raising is necessary, that people even understand whether they have a problem or not. Again, quite a lot of even self-help, digital help is now on offer. So I leave it there. I would like you to help me to say whether you are happy with the two proposals.
So let's take comments and questions on that first, and then we'll let Andrew talk about the trailblazer.
No, I don't think I'd be surprised to hear me wholeheartedly endorse as mental health lead. I think the community conversation, would be really valuable. I take Dave's points about lots of engagements, but I think mental health has been neglected. So I think it is an area that would warrant that focus. And as a local authority in the CCG, we employ a lot of people in the whole that are a lot of local residents as well. And I think focusing on the mental health of those employees will also be really invaluable. I think the suicide prevention work has been great. That's a really good programme. I think that's a really positive thing that's been produced over the last few months. I commend that. About the primary care mental health service, that's a service that will start from the 1st of April and incorporates 3 main components. There's a wellbeing component that again we need to make sure feeds into all the other directory of services that have been mentioned, but we need to ensure that that one fits in with that as well. And that's there as a resource for the community to advocate for people, help them access services that will be there, and that has strong links with social prescribing. The IAP service itself has been asked to link with long-term conditions, with physical conditions specifically. And then alongside that, there's also a primary care recovery service that will put mental health care workers within the community that we want to try and integrate properly with other services that exist. So that's the kind of offering that will start from the 1st of April, and it will be a really enhanced offer on what the local population have had up to date. So I think that's a really positive thing. I think that was the main thing. Thank you.
Yes, I just wanted to wholeheartedly endorse the mental health and wellbeing in the workplace. I've experienced a horrible workplace environment when I was bullied, and I had absolutely nowhere to go, and you didn't even have a human resources department that was supportive of you. And I'm a confident lady, and I know my own mind, but I felt about that big. And I love the idea of first aiders, and I think it's really important in the workplace because it's very silent, and people just go very quiet and just get on with it. And I think there's a hidden mound of people suffering in the workplace, and the idea of having first aiders and having a high profile where people know they can just go and have a conversation is really, really important.
Yeah, I would definitely endorse that. And I think what was really good about the report was that recognition that that staff who are offering debt and welfare advice are also in that category. I don't know if it's right. Are also in that category of people who need this kind of support. Partly because of the client group that they're working with and the things that they might see and experience. And one of my colleagues from the sector asked me to just sort of give this example. So their comment was that one of their clients died by suicide over the Christmas period, and that they had been recently bereaved and struggled to get over it, but sort of compounding that were sort of really awful problems with universal credit. Over the months that followed and preceding their death. So, and I think their comment to me was, oh, we failed this man. And I would almost turn that round based on what we've talked about this evening, that we wouldn't want them to feel that way, so they definitely need that kind of support. And I think that's true across, I see it in my own staff team, I see it in colleagues in the sector. That these are difficult issues and people would really benefit from these initiatives. So really, really positive.
I'd just like to make a few comments. I wholeheartedly endorse both. I think it's fantastic and they are very worthy priorities for us. Just going back to Thrive, I know that they did quite a lot of consultation with children and young people of London. And on page 42, they have a really nice summary looking at a quote where someone says they want to give young people the power to lead and have their own conversations. And I know that that's something that's come up within our own youth forums about making sure that young people feel prepared to look after themselves and others in a sort of peer-to-peer system that is safe and secure and appropriate. So I know some of their suggestions here were emphasising the need to promote and support mental health champions, create community youth forums and support peer mentoring projects. And I think that they are things that forums would be very interested in and I would endorse. I also, on the workplace agenda, I have a mental health first aider in my workplace, and I know that if I feel that I need to chat to them or others do, they are always available. They're happy to be signposted to and can signpost appropriately. But having that base knowledge spread across an organisation where people can identify certain triggers, not symptoms, but flags, and help other people to signpost themselves is no bad thing. Thank you.
Thanks, Dagmar. Again, I welcome the report and endorse what's been said already. Welcome the fact that you've also given us some very good examples of some of the good work that's happening already in the borough. In terms of Thrive, it would be good to also learn from the lessons and the good practice that's already out there with the other London boroughs that they've been working with. So whilst we're looking at it and talking to people, to be able to say, look, this is what's already happening and this we can replicate that here. I think that would be helpful for us. Again, I endorse everything that's been said around health the workplace and well-being in the workplace. In fact, tomorrow we do have a workshop for leaders of the voluntary sector, just looking at particularly that issue as well.
Yeah, just to echo everything everybody said already, I was marking off points. The one bit I did want to add because there's a point there which is about asking employers to develop an action plan to get employers to start talking about mental health. The key thing for me is to transition from people talking about it to then themes come up, to then how will that be taken on, to actually have real time change around maybe the environment, practices, culture, the way you work, for example, late night meetings, doing this, travel home alone, etc. And to me that's where I would start for myself to start to measure how well, I mean there's dealing with everything we said, but how well it starts to inform our practice and how we go forward. So it was just to echo how to do that transition to that.
Again, a few things to mention. So picking up on Dave's point, there's something about the infrastructure for well-being, what that looks like. So we've talked a bit about intervention, but that's after some harm has been done, and one of the things that's really important is to not harm people's well-being in the first place. So that links to all of our other strategies. It's about what our outside space is, it's about what our access is to leisure, it's about what our employment looks like, it's about housing security, income security. So I could go on, but I think you get the point. I want to explicitly link this to some stuff that we've already talked about. So for the family, the mental health of parents is a key indicator in the likelihood of mental illness emerging in children and young people. Ditto substance misuse and also domestic abuse. So some of the work that we do around crisis in adults is going to pay off in better emotional well-being and mental health in our children and young people. And that makes me want to link to a piece of work at the end of November that the police introduced under the title of Resilience, which was about adverse childhood experiences and trauma-informed practice. So from across London, nearly 800 of us convened at a cinema in Leicester Square to see a short film about the impacts of trauma and adverse childhood experiences on young people and how that plays out in adult life. And I think it would be smart if, as we drew all of this together, we included that as part of our thinking. And finally, I was reflecting on the decision to take advertising of unhealthy foodstuffs off our advertising, bus shelters and whatnot, in the interest of the childhood obesity strategy, and thought of all of the other images that we're exposed to that impact on our mental health. So I think it's a really good idea to change what's advertised so that we prevent obesity or impacting on physical health. What might we activate around in relation to the other images that compromise people's mental well-being? Thank you.
Entirely agree with everything that's been said so far. I think probably and it goes back to the point about linking up different forms of engagement, I'd probably just be keen for us not to underplay the role that psychological therapies need to play in terms of supporting people. Over the last 5 to 6 years, psychological therapies have moved from being a relatively small scale intervention to almost as a sort of population scale intervention themselves. The Merton IAP service now receives in excess of 100 referrals a week on a consistent basis, and the new service builds in the capacity to expand this still further, so that we're seeing, ultimately we should be seeing up to 25% of people with anxiety and depression in the borough on an annual basis being referred into the service. And there is a range of different support that can be offered, right the way through from a relatively low level intervention through to more intensive interventions, and a range of different modalities, including one-to-one group and online as well, which can be done around people's busy lives. So I think that actually, what I take away from the Thrive workshops and engagement, from the intention to engage within workplaces as well, is an opportunity to have the mental health and wellbeing aspects really clearly signposted and to build that capacity, but also to make sure that we are getting the people who need some more clinically led support into that support in a timely way, because a lot of those interventions are much more effective if they are made early on in somebody's anxiety and depression.
Thank you. Everybody said everything, of course. To bring things down to the prosaic, which is my level, I'm always impressed by your papers, Dagmar. And the breadth of this, and this is a genuinely neglected area. I think it's certainly in the mental health arena. My concern is, community conversations, engagement in this excellent initiatives. Are we resourced for it? Are you resourced to run that? Because I'm really concerned that we talk a lot and we put plans, but I'm really focused on delivering, if you like, to particularly the harder to reach people in the community. And Health Watch, obviously, I want to use that to as a vehicle to assist you as far as we can, but it's always resources.
That's why. Sorry. I completely agree. I certainly didn't intend to give any impression that it's a single-handed job here. I'm glad that I've got a committed board around me with all the joint resource we command. The particular invitation from Thrive London for me was almost the other way around, that there is a resource that offers itself up and we haven't taken it yet. So that is for me leveraging where we have very little, and as others have pointed out, because they have now been in 17 boroughs, and there might be some advantage that we are not the trailblazers, so we can learn from what has gone on before. So I hear your concern, but I think on that one, the resources from outside will help. On the mental health in the workplace, it really is for all of us and the workplaces we have some influence and control over to take the baton. And I have volunteered to help with systematically thinking what workplaces can actually do, sharing resources, sharing templates, sharing charters, and as obviously Rachel has said, we want to focus on the mental well-being of the workforce, because that is the topic we're talking about. But poor mental health doesn't just drop out of the sky. There are root causes for poor mental health, and so there's a wider context, and some workplaces might feel enthused to think wider than just the mental health, and we can help.
Going on along those lines, absolutely thinking beyond just the mental health is that we know, as mentioned, everything else can impact on mental health. And one of the things which these models is really thinking about how social prescribing can really support that, as well as addressing the clinical health needs appropriately. And if we embed this alongside the others and think about having those conversations as a norm, I think that can help towards some of the resourcing as well.
It's a quick comment, I'll again.
It is quick. I think it was just following up on that IAP point, and that we absolutely see the value in it and how important it is, but I think some challenges have been is when we've signposted to it, although the initial assessment is very, very quick, actually then the time frame to get in to see somebody is running 3 to 4 months, and that can be quite challenging, I think.
Yeah, I mean, just to say that the change in the service model from the 1st of April and specifically the change of provider is very much in response to that feedback, so that we do get people through from the initial assessment into treatment quicker. It does very much differ by modality, so if it can be a little bit slower on the face-to-face, I think that if we can encourage more people to use things like the online options, then that gives us a little bit more flexibility to make sure that we're getting the right targeted interventions to the right people. But absolutely, that feedback and that patient experience has been one of the things that precipitated the change.
Okay, so I think we will support those two priorities. So at some point you will come back with a plan. Over to Andrew.
Thank you very much, Chairman. So I will try and be brief. I apologise that you've not had the slide pack sent round in advance. I believe we will be able to send it round after the meeting to you, so you've got that. I'm not going to propose to talk through each slide. I will try and pick out the highlights for you so that we can get through it and give time for questions. So this is a project that was jointly set up and led by myself, by Jed Cohen, the Chief Executive of Merton Council, and by John Goulston, who at the time was the Chief Executive of Croydon Hospital. And we set ourselves the task of dealing with the problem of self-harm. And at the same time, in South West London, we said that children and young people's emotional well-being was our top health promotion and prevention priority. When we started to work on self-harm, and we set up a stakeholder reference group, quite a broad group, about 50 to 60 people came to the first workshop to look at the problem. We quite quickly moved from the problem of self-harm through a root cause analysis to say where we really needed to intervene was around emotional and mental well-being. So earlier intervention rather than waiting for our young people to get to the point where they were harming themselves and turning up at A&E. And we saw those numbers rising. The rise in self-harm, including attendances at A&E in teenage girls, has been really quite staggering, and it's something we must deal with. The stakeholder reference group included people from health, across a number of different agencies, from local authorities, from schools, from the voluntary sector, and some children and young people as representatives. As part of the strategy development, we did significant engagement with children and young people. They did some great videos and some artwork that supported our development work, and actually you see some of the images in the pack. We also did an online survey. We didn't quite get the same numbers that Darren did, but we got nearly 1,300 in a week. Children, young people, parents and carers responding to the survey. So that really helped us refine the strategy. So if I take you on to slide number 3, summary of the whole school approach, so the previous one, yeah, and you probably can't see that, so I'm going to talk through it. In essence, what we've done is we've set up a pilot approach in each borough. So each of our boroughs in South West London has a cluster of schools with whom we are working to deliver a whole school approach, and that's the essence of the intervention. We're piloting it, so we will do baseline evaluation on a number of different metrics, including a survey in all children in year 5 and year 8 in those cluster schools. The cluster schools cover a population of young people around 5,000 to 6,000 in each borough in South West London. In Merton, the head leading the cluster of schools is Julia Waters, who's the head of Ursuline School. She was hoping to come and help me present tonight. Unfortunately, she can't be here because she's got another work commitment. But she's been incredibly supportive of the project, incredibly grateful to Merton Council for their support for her, and in fact we've had great engagement from the schools team at Merton Council in the programme of work. So the whole school approach that we're going to be delivering with those schools in Merton and in every borough in South West London is summarised here. So the top
circle talks about the ethos and environment in the school. We're going to have a standardised schools policy for ideally to be rolled out to all the schools in South West London. That's being developed by the schools themselves. The second circle going round clockwise is curriculum, teaching and learning. So the schools have committed to using PHSE time to do education around emotional well-being. We are providing an online directory of services of all the possible well-being services that support emotional and mental health in young people. And we're also giving them access to online peer support and resources. We have commissioned those two services. It's a joint effort from me to and getting it on, and that will be rolled out fairly shortly. The next box around is targeted support and appropriate referral. So we are in the process of procuring online support for all the children and young people so that they can access that themselves. In the whole school approach, each cluster of schools will have a mental health support worker that we've committed to paying for, and they will both support this approach in the schools, but they will also deliver some targeted interventions. So that's one-to-one support, group interventions in the school, and they will act as a link into CAMS services as well. One of the things we've committed to doing as part of the project is to look at the single point of access in each borough for CAMS services, and to make sure that it's genuinely a point of access for support, not a barrier to getting help. And there's a couple of elements to that really. One is really making better use of the Tier 2 services, or what used to be called Tier 2 services, so the children's counselling services. And the other thing is actually linking them into the directory of service, so even at a much lower level, the single point of access can signpost young people who don't need the high levels of intervention to more of the wellbeing type services. The next thing is working with parents and carers. So we've commissioned an EPEC model which was set up by South London and Maudsley Trust and has got really great evidence for its effectiveness. That's a train-the-trainer model for parents and schools. So parents are trained to set up support groups. That helps raise awareness among parents of mental ill health and how to deal with it in their children, and helps them deal with a situation where they're supporting their own child with mental health issues. There'll also be some informal group sessions as part of that programme. The next box around says monitoring impact. So we have a research partner lined up, because we've also, which I will come on to, been successful in getting national Trailblazer funding. We want to make sure that we use the same evaluation partner for both this work that we've committed to in every borough and in the 3 boroughs that are going to be national Trailblazers. So that's why that's not quite sorted yet, but we will have a research partner who will help to evaluate the programme. The goal being that if we can show this approach is successful and does have an impact, we will then be able to make a business case to roll it out across every school in South West London. That's the aim. The next box around says student voice. So we're committed as part of this to engage with children, young people and parents, and we want them to help design how this actually works in schools. The final box says staff development and support. So we've committed to support for teachers, a school culture that promotes staff wellbeing, system-wide training, and a number of staff are going to be trained as mental health first aiders. And we'll be training people to act as mental health first aid trainers as well, so that can be rolled out quite broadly. The schools are really excited about this. They're incredibly well engaged, and it's really encouraging to see how well they're responding to that. If I can just go on to the next slide. This just details all the different things that we've achieved. So we're doing work on governance, engagement and communication, recruitment. So we've recruited a Band 8A psychologist for Merton. So we've already now got them in post. We're committed to evaluation, to supporting the schools cluster. The action plan that the Merton Schools Cluster came up with has been approved by the CAMS Partnership Board, and that's really quite important to link this into existing structures. I've mentioned the digital offer that we're working on. Targeted support, it talks really about what we're doing in the Trailblazer, and I will come on to that. And then obviously the training that I also mentioned, which is the EPEC and the mental health first aid. So skip to the next slide, and then the one after should say Trailblazer, mental health support teams in schools. So on the back of the work that we had done, and where we were already planning to roll this out in 6 boroughs, we were in a good position to put in a bid for national Trailblazer funding, which we were successful in for Merton, Sutton and Wandsworth. They were the only 3 boroughs that qualified, because you had to meet certain criteria to be able to apply for
and the national funding. It's incredible that we got a multi-borough bid. I think we're the only area in the country that's got a bid that spans multiple areas, which is really exciting. And that's to the tune of £1.85 million extra new investment into children and young people's mental health, which is really, really good. So go on to the next slide. What that means for Merton, because of the terms of the Trailblazer, we will be expanding the reach of the schools cluster. So to start with, it was 5,500 pupils we were covering. We're going to expand that to 8,000. So we're going to add extra schools into the cluster. And if I go on to the next slide, so you really can't read that, so I'll talk you through it. And this really details what you get extra by being part of the Trailblazer. So essentially, rather than having one mental health support worker for the cluster of schools, the enlarged cluster of schools gets the Band 8 clinical psychologist, which is the one at the top on the left. And then they also get a Band 7 nurse practitioner, so half a working time equivalent of that. And then they get 4 mental health support workers, so wellbeing practitioners, who are basically trained on the job, because a big issue in providing the right level of support to children and young people is we don't have the workforce. So part of the Trailblazer, Health Education England have set up a pipeline of graduates to go through training to be mental health support workers, and they're going to be trained on the job. So currently they're doing 2 days a week in South West London supporting the schools and 3 days a week in training, and they get supervision from the senior clinical psychologists. So they will in the summer term start to deliver interventions in the schools, which is really exciting. Skip the next slide, and the next one and the next one. So going on to which schools are involved. The schools who are already in our cluster in Merton are these primary schools, so Sacred Heart, St John Fisher, St Thomas of Canterbury, St Peter's and St Paul's Catholic Primary School, St Teresa's, St Mary's, and in secondary schools, Wimbledon College and Ursuline High School. I've worked with the schools team in Merton to agree how we're going to roll it out to other schools. So we're going to include a pupil referral unit and other schools, so that we've got a really good balance across both East and West Merton and a good mix of primary and secondary schools. So that's really encouraging that we've been able to agree that. And then that is the last slide that I wanted to go through actually. I'm sure you might have some questions, and I want to leave time for that if that's the case.
Questions or comments for Andrew? Lady wants to answer the question.
Just a comment really, I noticed that most of the schools you named were actually Catholic schools. Is there a reason for that?
Yeah, there is a reason. They were the ones that turned up. So we opened it up to, we engaged with a lot of schools, and they turned up to development sessions, they engaged, they wanted to drive it forward. Because it's a pilot, we decided to go with those schools that had energy to make this happen. It's really important we prove this is successful, so we wanted to work with schools who really wanted to work with us. As we've looked to expand it, and as the programme has taken off, more and more schools in Merton want to take part. As I said, we've engaged with the schools team at the council to try and make sure those we're adding in balances that out a bit. The goal will be to prove this is successful, and when we have, we'll be able to make a case to roll it out to every school in Merton.
Okay, thank you.
It's a question from one of my colleagues that was sent to me in advance, and it was just about how Trailblazer fits with iThrive.
I think they basically just complement each other. iThrive has a number of different levels, and that's the same sort of approach we're proposing in the whole schools approach. And a lot of what we're doing is really trying to invest in the much lower level, so supporting resilience as well as the getting help. No, I just want to, I think it's really good, especially for me, as a thing that I've always throughout my career and all the work I do, especially being a former looked after child and some who work through leaving care as well, is there's always been a lack of any investment within kind of what I would see as true prevention, which is then trying to help tackle it at the earliest possible stage. And I think a pilot project like this is really one of the ones that comes across as actually hitting that mark for the first time. So it'd be interesting to see it kind of grow and develop.
I mean, I think it's fantastic scheme. And fantastic that we've secured additional funding from Merton. How quickly will we have some results to determine how successful it's been and whether we can grow this out further?
So we're going to do the first survey of children and young people, so in years 5 to 8 in the spring term. We'll then repeat that spring term next year, so we need to give it a year. So it may be, if we're confident we've seen an impact, we might be able to do it in the term before that, but it won't be till early next year that we can, at least at the earliest, that we can repeat the survey. Once we've got that data, then we'll have something to go on. That's not the only metric we're using. We're looking at A&E attendances with self-harm, which is quite the tip of the iceberg really, but we're also looking at a number of other things such as referrals into CAMS, access times to CAMS, and all sorts of other data to inform the decision.
Well, please pass on our thanks to all of the schools involved, between you and particularly Julia for leading that, and we look forward to hearing more about it in due course. Okay, item number 6, which is an update on the local health and care plan. Is that James?
It is, yes. Josh Potter can't be here tonight, so I will take the paper. I'm going to whiz very quickly through this presentation. There was a short video as part of it, so I hope you'll indulge me with showing that, but I think it's helpful feedback from the event that we had in November. And then I will try to highlight what some of the next steps are, and in particular try and highlight some of the links into other items on the agenda tonight, in particular the community plan, some of the items on mental health, and also when I come to give a bit of a verbal update on the NHS long-term plan later. So, just to recap, Merton Health and Care Together is the programme that we've set up to both develop our local health and care plan and also to put it in place, and it is a programme running across health and social care, public health, and all the different sectors that are involved. And this is what we have agreed is the vision and the way that we plan to deliver it. So that should be familiar. This is some of the data that we've been using to develop the local health and care plan. So these are some of the metrics that can fall out of our joint strategic needs assessment. They are the same data that inform the health and wellbeing strategy, the local health and care plan, and indeed much of our other planning across public sector bodies in the borough. And the challenges that are set out there will be familiar to many of you. And it really emphasises some of the significant health inequalities and also the complexity of the multiple challenges across multiple communities within the borough, and we need to address all of them with equal vigour. Let's move on. This won't work terribly well on the presentation because it's relatively detailed, but this is, previously we've shared, this is effectively the plan on a page, which is the summary of the draft local health and care plan, and is what we've been working on as Merton Health and Care Together in terms of our priority areas. And this falls into a taxonomy, a format of start well, live well and age well, which again is in common with the health and wellbeing strategy, and also, although it's not quite called that, falls out of the NHS long-term plan as well. I think this is a way of looking at health and public health and care services in terms of a strategy and really a whole life and whole community approach that seems to have been quite widely adopted now. So very, very briefly, our focus is in terms of the development of the plan on emotional wellbeing and mental health, children and young people's community services, developing pathways into adulthood, the East Merton model of health and wellbeing, diabetes, primary mental health care, primary care at scale, and then integrated health and social care and dementia-friendly Merton. I just go through those because as we talk about the long-term plan later, it's worth bearing in mind to assess the degree of read across that we have. Now, we'd started to develop these priorities, and in fact we've talked about them here, before we had the event in November, But let's moving on to the event. Really, this was a really great opportunity to begin to share some of our insight and thinking, to have some really great presentations from people who have been involved in developing it to date, and to start to get some real co-production and deep involvement in firstly, are these the right things, are the things that we're missing, but also in practical terms, how should we take them forwards. So we had 151 people in Chap 89, and that included frontline staff, a representative sample of local people, and community and stakeholder groups as well. And if we just move on, then hopefully there's a little bit of a video. You want to try coming out the presentation? Oh, there you go. Oh, you have it.
We need to understand the health and well-being of the whole population in that, not just those who knock at the door of our services. Keep that in mind. Lots of people starting well, living well, and aging well. And I think that's really important because we're looking at the whole life cycle of the individual who lives in Merton and making sure we do absolutely the best for them.
It's really important, I think, the local authority, the NHS and the voluntary sector, with support from our NHS and social care providers as well, really work together to provide integrated, joined-up services that meet the needs of local residents, but particularly those who need higher levels of support.
Today I've mainly focused on conversations about mental health, because personally there's something that I've suffered with this last year, just about the prevention, about the treatment that's available today, and then hopefully what we can work out together moving forward. I'm hoping that I'm going to be able to influence plans, and that feels amazing because it needs to come from the people themselves that are suffering with these things, and their voice needs to be heard, and the fact that there's a massive group of people today, all with different ideas, is just incredible really.
We were looking at children's therapy services. What do families want, and how can we make the services more streamlined for the needs of the young people that are in Merton? It needs a lot of events like this, but there's a better positive energy in the room about making a difference today.
We're having conversations about children's mental health and well-being, and conversations about various services that are delivered to children and their families in the borough. Education has been missing from this conversation, really, and it's important to get it inside the integration debate, I think.
It's great to sit here with all the disciplines around the table, because very few and far we get these meetings to talk about what really matters to Merton and how we can make a difference. So it's great to be here.
Actually, it's been very lively, very engaged people, and great to get so many people together to talk about these kind of issues.
The interest in coming here is I hope that the talking can start when the doing can start.
I think it's really exciting what is in the future for all of us, patients, people in the public, and for the professional. They get a sense of when they're achieving things and they're making people satisfied and happy.
Okay, so, what I would say was it was a extremely are you okay. Anyway, I'll keep on talking. It was an extremely positive day. I think that in terms of the themes that we took into the event, there was an awful lot of validation that these were indeed the right priorities to be working on. I think that an awful lot of what emerged was actually about how we go forward with them. The need for ongoing co-production beyond one day, and also the need to involve partners who perhaps in the past we haven't considered as part of the system. And Rachel's point made in the video there was actually one that came through many times during the day, in particular about the involvement of education in schools, particularly around children and young people's mental health, as a really good example of that. But on this next slide, this is just a snapshot of some of the feedback that we captured during the day, and there's many more pages and photos of feedback that we're now integrating into the development of the local health and care plan. Let's just move on. And I won't go through that. That's just a summary of some of the feedback that we had on the day. So let's talk about next steps. So we've already started to talk within Merton Health and Care Together about some of what emerged from the day, and we are well down the line now in developing a draft local health and care plan for Merton, which is based on the conversations we've been having and the feedback that we had on the day as well. What we've also done as a board, a couple of things to start moving from the talking into the doing and answer Brian's challenge. So the first is the board has been piloting some initiatives over the winter, particularly around community and social care integration to make our health and social care system work better, particularly for those leaving hospital. And that's given us a really valuable insight into some of the challenges we face, but also some of the opportunities from greater working. And that actually has enabled us to test some of our ways of working and working more closely together. So that's been an extremely positive thing to do. We've also had a look at our planning priorities as individual organisations for next year, and where there are aligned priorities falling out of our operational planning in terms of things we're all taking forward next year that align to the strategy and to the overall priorities within Merton Health and Care Together, and have identified a number of sort of year one priorities, if you like. So particularly the pathways into adulthood, particularly for further work on implementing the outputs of the diabetes truth conversations and really putting that into our public health and our primary care service models, and also specific aspects of health and social care integration and improving the support to elderly people. And one significant investment that the CCG is currently considering is around enhanced support to people in care homes, where we know that there's a lot more that we can do than we do at the moment. So this is about not just strategic planning, but also making a difference to what we do straight away as well. We will be bringing back to the Health and Wellbeing Board a discussion document in March, and in fact at the next Health and Wellbeing Board, which will reflect both those year one plans, but also, you know, a fully working draft of that local health and care plan. And we will be considering feedback on that document and recommendations for inclusion in the final health and care plan, which we hope to finalise during the first quarter of the new financial year for publication in July. Now, what I would say is that this is an interesting time to be writing a local health and care plan, because, as we've highlighted, we have a number of local planning exercises. We also have the publication of the NHS long-term plan, which I'll come on to summarise later in the agenda. But I think it's really important that we reflect on the existing priorities we have as organisations, some of the work that we've been doing for a very long time as a board, for example, around diabetes truth. That is still a priority, it's still the right thing to be doing, and we need to build on that, but also to ensure that we have that alignment with documents such as the NHS long-term plan. What I would really highlight probably within the local health and care plan and within Merton Health and Care Together is not the change to something new, but actually the continuity with everything that's been happening in this board for a couple of years. It is really building on that and strengthening it and taking it further. So in a way, you know, the production of this document is another step on a journey rather than I think an unfurling of something that's sort of radical and new. And I think that it's a great credit to the approach in Merton that we've been actually on that journey now for a little while. So I'll stop there and take some questions.
Questions or comments? Yeah.
I think it's almost worth waiting for the health and wellbeing strategy, because they complement each other very well. And so That's been my comment rather than
Well, I can't let it pass without commending the artist's impressions of Andrew and Dagmar in the sketch, so please do all enjoy this. Thank you very much, James. Moving on to item 7 then, and before I ask Dagmar to introduce, you should have all received, when you came in, a draft letter. I received an email from NHS England. Has everyone got one? It's coming around now if you haven't. So I received a letter from NHS England last week asking for the Health and Wellbeing Board's feedback on the CCG's input into the health and wellbeing strategy. As ever with the NHS, we had about 6 days to turn this around, so it needs to be submitted on Thursday. So the draft letter is before you. I'd like to be able to say that it's been agreed by the board. I think it sets out the journey that we've been on over the past few years and the sort of board we now are. But happy to take comments after Dagmar's introduced the paper, but hopefully you'll all agree that that's a good representation and are happy to support it. Dagmar.
Thank you. I wanted to update you a little bit on where we are with the Merton Health and Wellbeing Strategy refresh. And especially as Kadiru said, I want to sort of major on 2 things. The first one is, how does the Health and Wellbeing Strategy link up with the local health and care plan? Because there is really a lot of thinking that has gone into it. But I also have to confess, and Rachel and I were in meetings where we've also encountered some confusion. And so I thought, if we as Health and Wellbeing Board members understand it properly, then that is a better chance that our stakeholders also understand it. So the thinking was that the Health and Wellbeing Board, as the statutory system leader for in health and well-being in a borough, really will focus in its strategy on creating what we call a healthy place. So creating the conditions, and these are the physical, and Chris is obviously on our board, the economic, the social conditions in which people can thrive, and in which, for example, a healthy choice is the easy and preferred choice. And because we have all committed to the local health and care plan, that we put our energy around what our health and care service offer looks like into the local health and care plan, so that we're not trying to duplicate. And in order to facilitate the connection between the two and the read across, we've said we're adopting the same main themes: start well, live well, age well, but very much, as you can see in the little graphics that we're using, surrounded, supported by a healthy place. And I think there is some logic in it, but the recognition that the logic gets lost and people then deal with similar sounding plans and might get lost, I wanted to highlight to you, so that when you are out in your constituencies, you can explain the rationale. And one of the learnings that this board has always been quite explicit about is that its strength doesn't lie in covering everything and anything, because health and well-being could be just anything and everything. But that the strength in the board lies in focusing on a few things and doing them well, acknowledging that there are loads of other laudable things happening as well. So when we are now refreshing the Health and Wellbeing Board strategy with an emphasis on healthy place, that is still our aim, that we are always checking out and saying, what is it that this board, these members around the table, together can add most value? not anything that would be lawful. So quite important. We're also quite clear that the board does not start from a blank sheet, so therefore we call it a refresh. We're quite proud in a way of our history of having reflected on our values. You know, our commitment to fairness has always coloured the workings of this board, and for inclusiveness, and a absolute emphasis on prevention and early intervention. So those ones we want to enhance and build on rather than question and challenge. So I then wanted to just draw your attention a little bit where we are now and how we're going about to refresh the Health and Wellbeing Board strategy. We were quite inspired in a way that the proposal that the board actually leads and owns the strategy was agreed by you, and we've created a range of workshops covering the different themes: start well, age well, live well, age well, and then a summary workshop, healthy place. And all of you have committed to contribute to these workshops, to lead and table discussions, which I think in a way is a real credit to this board, because I've looked up and down the country how Health and Wellbeing Board strategies are often happening, and there is a very diligent officer writing it, and the board nods it through. And what you have already inputted, and what there's still the age well workshop and the healthy place to come, what you've committed to do, I think is really great. And so I'm confident that by really working jointly, we land this in the most useful place. That's all I wanted to share with you tonight, and definitely encourage those who have places for age well. This is 31st of January, this Thursday, and then our summary workshop, led particularly by Chris, where we put all what we've heard together, which we call Healthy Places, on the 12th of February, and I think we have almost all Health and Wellbeing Board members signed up, and I think that's absolutely brilliant.
Claire, did you want to ask your question then?
Well, really, I think just to welcome both reports and the Health and Care Together plan and the work so far on the Health and Wellbeing strategy. I'm lucky enough to sit on both boards as I've been involved in the processes. But I think it's just important in terms of saying the approach, the key themes that have been taken, and also the cross-cutting theme of place. I think that sits well within the strategy, and I welcome and I look forward to that workshop as well. That we'll be looking at that. I think it's also important to make sure there's that both complement each other and avoid any duplication of effort and so on. And I think that's what we've been thinking about a lot. And I think that now leads to the fact that if you look at both strategy templates, to be able to see very clearly where it sits and what they're trying to achieve. And I think that's important too. But I praise the work that's been done so far on this.
Thank you. There we go. I think one of the things that was really interesting about what has been done already, and so my apologies I didn't make it to the Live Well group, but some really fascinating stuff has come out of that, and particularly this sort of thinking around the influencing factors in the environment. I mean, that's clearly absolutely key. But what sort of struck me in reading that was, at Merton, we've just done quite a detailed amount of feedback for the local plan, and there are some themes that probably correspond. So I suppose there's a question there about how much that will feed in and influence, which I think will probably be really helpful. And then I think there was just a question which came again from colleagues in the sector, which is slightly shorter term, and I hesitate to mention the B word here, but there was this question that came. It's like, well, look, what are the short-term arrangements for dealing with the possibility of a no-deal Brexit, particularly with reference to activities like lunch clubs and meals for children? Because the concern that's been raised by local colleagues is that organisations don't have the space and they don't have the money to stockpile, and then there are just some concerns about whether that is genuinely necessary or not. We don't know. That's what was being said in the news, but that could have an impact on delivery of what are really quite essential functions. So there's a kind of short-term question and longer-term question.
I'll ask Chris to talk about the local plan and actually give Dagmar time to tell us what's going to happen with Brexit.
Fix it, Dagmar.
Well, I suppose just to kick off by saying I think the process is incredibly full, and I'm really enjoying it and looking forward to the final session that we've got on the 12th. So no pressure there, like that. The local plan will clearly feed into this, and we're just working through all of the comments and responses that we've got. But it will be. That process will lead to our next sustainable development plan, our local spatial strategy, which has to be set in the context of what we want Merton to look like for the next generation and generations to come. So it will be front, right and centre really in terms of our approach to creating a healthier place.
And I think both James and Paul were at that workshop. Come on, Dagmar.
Brexit.
Sorry.
That's fine, and we have got a whole board, so I will start and then I will hand over to you colleagues. I think the plan at the moment, you will have seen in the news as well, local authorities do have activities around preparedness going on. It sits in local council in our corporate team, and I think rightly so, because the health and wellbeing impact is obviously significant and worries us particularly, but the impact is absolutely corporate. And at the moment, I wouldn't want to, in a way, cloud out the activity of thinking in the medium to longer term around our health and wellbeing vision, to being completely distracted by Brexit. And so I'm quite happy that the two processes happen both. Longer term, we will see what will the solutions look like, and whether then we have to bring the two work streams closer together when we know more is still an option. But that is speaking for the local authority. I might want to ask the CCG possibly to add in what they're planning for Brexit looks like.
So we're working as part of the South West London system because there are very few sort of specific issues that are specific to one particular borough from a health perspective. We're working with providers to assess the availability of workforce in specific sectors. I think we are worried about the care sector, the impacts from the care sector, but we know that there's some local authority leadership in that area. More specifically, CCGs have been working with their providers to assess the impact on key supplies and also the impact on staffing, and also with the primary care sector we have a medicines management team, and they've been part of coordinated action with NHS England around supply of drugs and making sure that we've got enhanced surveillance around the supply of certain drugs as well. So, I mean, I think, as you say, Dagmar, until we know exactly what it looks like, it's kind of difficult to know exactly where some of the pressure points might be. There is quite a well-established command and control sort of system ready to mobilise if it needs to, and we are all clear at different levels of the system what the different kind of our roles and responsibilities will be. I think it's quite important that everyone is clear what they're not responsible for as much as what they are, so that we don't all try and be helpful and trip over each other. But NHS England have given us some very clear guidance in that respect.
Spending the evening drawing links between things, aren't I? I wanted to reference the idea of a healthy place in the context of children, children's freedom, children's access to space to play, children's sense of belonging and identity within a community. And it's quite easy, I think, to think through what good spaces look like for younger children, but we find ourselves in conflict quite often around what good spaces look like for adolescents, for teenagers. And so the link I wanted to make was between this piece of work and a piece of work where we've successfully bid to be part of a scale-up of contextual safeguarding. This is a way of thinking about the well-being of young people, not in terms of what's going on for them personally or in their family, but what the environment looks like and how that contributes to them making risky decisions, getting involved in things that they probably shouldn't have, being exposed to exploitation, whether that's criminal or sexual. And so just thinking about what good access to space and place looks like for adolescents and making places more welcoming for them and places where they can feel safe and do safe and enjoyable things together without everyone treating them like they're a nuisance or a threat. So quite often they're excluded from public space because they're perceived as a threat, but that makes them less safe in their community, exposes them to more risk. We're really pleased that our team has been selected to participate in this scale-up supported by the University of Bedfordshire. It doesn't come with any money attached, but it does come with kind of research capacity and support, so helping kind. And it's very much in the zone of what a healthy place looks like, and I'm looking forward to being part of the roundup as well. Just wanted to make the board aware of that.
To answer Lila's question specifically about lunch clubs, we've got over 20 lunch clubs or social clubs in the borough. They provide over 770 meals to the most vulnerable residents in the community. As you mentioned earlier on, we have a project that's now mapping that, led by Heather Begg, who's our Voluntary Sector Commissioner. And we are looking at that as part of the mapping, Lila, around the capacity and how they will manage the Brexit situation around food. Asked with there's not going to be any food at the borders, etc., etc. So we are looking at that with them.
So the next time we see this, it'll be final, or more or less final.
Draft.
Final.
Sorry.
Draft final or final.
There's a process.
Has anyone got any comments on the letter, or are we happy that I submitted it? Good board approval, thank you. Okay, agenda item 8 is an update on the NHS long-term plan.
I'm going to make this mercifully brief.
Unlike the plan itself.
Unlike the plan itself, which is a good old hefty NHS strategy of 136 pages. Helpful as a sedative. Oh dear, I'll probably get quoted saying that. But anyway, so I mean, the NHS long-term plan is the next 5-year strategy for the NHS. There was a few years ago there was something called the 5-year forward view, which I think we almost got to the end of it before this replaced it. But what the long-term plan is really looking to do is implement many of the things that were piloted under the 5-year forward view, particularly in terms of more holistic models of support for people, and to take an evidence-based view on how the NHS should move forward. This is in the context of the long-term settlement made between the NHS and government around funding, which increases funding by about 22 billion over 5 years. So this is very much how the NHS is going to be asked to commit some of that additional funding. Just to talk about some of the areas within the plan, I mean, anyone can read it. There are innumerable summaries being produced, and actually one is being produced by the South West London Health and Care Partnership, which draws the link between the long-term plan and local health and care plans. So when that is finalised, I will circulate it, because that's probably the one that you would want to see. But just to highlight some of the areas I think that we're already working on in Merton. So the plan talks about primary care networks of local GP practices and community teams. We have been developing integrated locality teams locally, and also guaranteed NHS support to people living in care homes, which is very much in line with what we've talked about through Merton Health and Care Together, and more broadly supporting people to age well, particularly people who have dementia or are more broadly frail. Plan also talks about reducing pressure on emergency services. We know this is one of the key demand areas for the NHS, and we've been working with all of our local hospitals on, it's called same-day emergency care in the plan. What this really means is models that allow people to attend an A&E and be assessed and stabilised and treated and potentially discharged home, potentially with some support on the same day, rather than having a stay in hospital, because we know that a stay in hospital is very disruptive to people's lives and can have consequences in terms of maintaining people's independence. Another area highlighted in the plan is personalisation, and indeed many areas within the plan touch on personalisation and also social isolation, and a full rollout of social prescribing is one of the areas that's highlighted within the long-term plan, and is indeed something that we're looking at for Merton on a local basis. Another really interesting area is around digitally enabled primary care and also digitally enabled work with hospitals. So we know there's a lot of people at the moment attend hospital in person when they may be able to benefit from their GP getting advice and guidance from a hospital clinician, or from telemedicine, and we're currently piloting some teledermatology in Merton that allows you to have, if you have something on your skin, then the GP can take a high quality image using an attachment on a smartphone and send it off to clinicians at St George's to have a look at it, rather than you needing to wait a number of months as it might be for a routine hospital appointment. So there's measures such as that that are in the plan and that we're already taking forward locally as well. I think that some of the areas that are particularly highlighted as well are around things like personal health budgets, which is an area that we're looking to roll out. So this is where people are, say, in receipt of complex NHS and potentially social care as well. Social care has used individual budgets for quite some time, and actually looking to expand this across as well. So there's also a renewed focus on some of the causes of preventable disease and modernising some of our systems of disease, so in terms of earlier intervention in cancer, but also focusing on areas such as diabetes. I think one of the most interesting areas of the plan is actually the renewed focus for the NHS on prevention. So to sit alongside local authorities' prevention duties are a number of proposed targeted evidence-based interventions for the NHS around prevention as well, which we will be looking to take forwards. But I think what we're waiting for, as is the case with much of this, is a little bit of detail around how these two areas, so current public health and future interventions, will sit together in terms of the areas that the NHS, in terms of obesity, smoking, etc., is now being asked to have a look at. I think there's some really interesting areas. So it does highlight the increased commitment around mental health, and in particular around children and young people's mental health, where there are new and much more stringent safeguards for services in terms of increased investment, not just in mental health generally, but specifically in children and young people's mental health, which I think really handily builds on some of the work that Dr. Murray described earlier, and also our successful achievement of the Trailblazer status. I think one of the key challenges now, particularly in our local context, is about what our response to this is as Merton, and as also part of a wider South West London system. We know that all local systems will be asked to develop a response to the NHS long-term plan. We know that there's a push for local systems to move towards becoming integrated care systems as well, so more joined up bodies across health, public health and social care that come together in order to formulate an effective response to many of these initiatives, because many of them are not just commissioning new healthcare services. They do in some fundamental way get into a change in the relationship between the individual and statutory health services, and indeed that's a lot of what we've been talking about with other items today as well. So we'll be looking as South West London Health and Care Partnership about how we look at each of the boroughs plans and show alignment between the boroughs plans and the NHS long-term plan, and look at also areas that we need to pick up as a South West London wide system. But I think very much our intention as a system is to make sure that the implementation of the long-term plan is very locally relevant. It's a 136-page document, and therefore there are quite a lot of priorities set out within it. And what we need to do is make sure that, sort of rather than taking the first one on the list, we refer back to the areas that we've identified as most important for us, and we work through them systematically, building on the engagement that we've already been undertaking for a period of time. What is helpful, but also slightly builds on the point about engagement earlier, is that we know that local health watch groups are also going to receive national funding to support local health organisations in ensuring that implementation reflects local views. So we're working with the health watch group across South West London to work out how we do that. Again, to make sure that this is something iterative and builds on all the work we've been doing locally, and doesn't sort of duplicate all the conversations we've already had, because that would be a shame. So that's probably all I want to say for now. As I say, when we've got a document that summarises the long-term plan and also shows how it's going to link into our local health and care plans, then I'll get that circulated to the Health and Wellbeing Board, so that people can see how it sort of all hangs together. And as I say, there are a couple of summaries that you can look at as well.
Thank you very much. I wasn't going to take any questions. Are there any questions?
Just a comment really, that while Adult Social Care welcomes the 5-year forward plan, the missed opportunity around the Green Paper for the future funding of adult social care. It was supposed to be published last June, delayed to the autumn. Now we're told it's going to be April. There's a huge linkage between both of these plans, and really you need to see them both together to see how adult social care is going to be funded in the future, and really how we're going to link and integrate better with health. That was just a comment.
I mean, I would agree. I think that there is there is a great amount that we can and indeed are already doing, but there are still times when the marked difference between how the two systems operate, puts a bit of a sort of a threshold on that. And we both CCGs and local government have their statutory duties that at the end of the day they need to go back to a certain extent. So I think I would say that to understand how that gap is going to be closed would really help us to make this a very sort of rounded plan. I think we'll in the absence of that, we'll do what we can.
Okay. Thank you very much. Final item is on Dementia Friends training. So I said at the last board that we were keen to have all board members trained as Dementia Friends. The proposal for those who haven't yet had the training is to see whether people could make it to the next board for 5 o'clock and have the training immediately before that. That's on Tuesday the 26th. March, sorry.
I'm coming back from somewhere else, so with the intention of being in time for that.
So what I propose is that if Clarissa knows who needs to do it, if you send an email out tomorrow, and then we are looking at a separate session for the voluntary sector as we discussed last time, which we'll get in. Good. Okay. Thank you very much. Enjoy the rest of your evening.
Could I just ask one question, please? We've heard a lot about positive responses this evening. A lot of congratulations and well done. You've just been talking, for instance, about the long-term plan. There's lots of stuff in there, lots of things that I've heard people express concerns about. At what stage can we, as a member of the public, hear what concerns any of you might have with any of the detail of that plan? Because it's a marvellous plan, it's wonderful, it's terrific. when are you going to challenge anything in it, criticise it, or even reject it as a plan? Or does that not happen?
Well, I think as James has explained, there's obviously some work going on at the moment to understand how it is relevant to South West London. And I think James said that we, as a South West London unit, have to respond formally. So at some point, we will discuss what that response is, and that will be the point at which we say whether we think it's a good thing or a bad thing for Merton and for South West London. And you as a member of the public will be welcome to attend at that point.
But it's not appropriate at this meeting to say that there are some things that you might not be altogether happy with, altogether secure that it's a good idea.
I think at this stage we're still digesting the detail and looking at how it fits in with what we're already doing in terms of that local plan that was discussed earlier on.
Okay, thank you. I look forward to hearing your concerns.